We're going to do a review of main points from everything that we learned. We had 6 sessions over the past month and a week or so, and I hope you have learned a lot or learned something new about harm reduction and substance use and HIV prevention and safe sex. We're going to talk about each of the use disorders that we had covered previously in class, and then also the HIV and STI prevention that we talked about last week, as well as the intimate partner violence prevention. So as a reminder, harm reduction, it's about safety, dignity, and empowerment. We've talked about it being a social justice movement that's really centered around people who use drugs or who use injectable drugs or unsafe sex, that they're the community members had started on their own of this harm reduction movement and the centering because the government was not really giving them what they need and really taking away some of that stigma and some of those negative perspectives of them and really prioritizing their lives. This is something that centers around community care and being that upward push for centering safety and dignity and empowerment. There's so many threads of similarities in all of these movements and all of these celebrations of being about resistance and being about community-centered community advocacy that are really showing that members like us are the ones that really change things. It's not really people that are outside of this community that even know what our needs are and often have variable levels of how they prioritize what we need and see people in the community, especially in East Harlem, as really valuable people that deserve the medications and resources as any other community. So that really comes from the community members really pushing for these changes that happen and harm reduction being so intertwined with Pride Month and especially a lot of transgender activists at the time that had overlapping of seeing this HIV epidemic just spread and not getting enough from other resources and really having to push for this activist movement to get what we need. So just remembering that is hugely our history. And then we tend to think because Black and Brown communities are the most affected right now with the drug crisis and with just being disenfranchised and not getting enough resources in a lot of our communities. This did even start with Asian communities back in the 1800s of some of these stigmas that were associated with immigrants. So all of that to say that all of our fights are very connected and harm reduction is a huge part of all resistance and desires for our communities to be better. The pillars that we have, the main staples, the priority to be minimizing harm, that we acknowledge that drug use is in our community for better or for worse, often maybe for worse, but it is out there. And what we do want to do is minimize the harm that it causes, both to those individuals and to the community around them. And we know that drug use really affects the individual as well as their support network, their family and loved ones, as well as the larger community. So we acknowledge that. We know that there are harms and dangers associated with drug use, but that there are ways that people can use drugs in a safer way. Not every single drug is the same. So all of this to remember the nuance that drugs are a spectrum and using is a spectrum. What we do want to do is make sure that we're looking at other people. We don't know their history. We don't know their lives. So we're looking at them with non-judgment and non-coercion. We don't want to be imparting our ideas of being like, drugs are bad, just don't do them. That is simply said, but for a lot of people, this is their reality. They've maybe grown up with that exposure for a long time. They've maybe experienced crazy trauma in their lives, really bad experiences with the medical system, have had nowhere to turn and end up turning to the only thing that has helped them feel better. So we really want to come without judgment or our own ideas that we need to just stop. That might be the goal, especially for me as a physician. That's often the goal for many people, but it's also this acknowledgement that some people may use drugs till the day they die. And we want to really make sure that they're using it safely if they're going to be in that mindset. Ideally, they don't, and they find other ways that they can cope. And we find other kind of medications and treatments for the things that are driving their drug use, but that's not always the case for people. So we really meet people where they're at with what they feel like is feasible for them, how far we can push them into practicing healthier habits that maybe is towards less drug use, but it's never about coercing them or forcing them because that does not work. Even if we want to scream it at people to just stop, that may feel better for us, but that's really not changing what the person is doing. So to be effective in minimizing harm, in helping people, we really want to meet them where they're at, and We don't want to ignore it. We don't want to just condemn it and shame them. We want to gently find a way for people to use things safely and start building community and feeling more seen. And that can often lead people to make more positive changes in their life. So we talked about harm reduction being so many different things that we do. Just because we have a risk when we ride a bike, that's not going to be the entire reason that we stop using it. But maybe if you do have like a broken limb, then you stop. So really when it gets to a point that you are really hurt, that may be stopping a certain behavior. But until that point, what you really want to do is protect yourself as much as possible. So we really want to reduce harm without necessarily requiring that we just stop. If someone is open to stopping or wants to stop, that is something we definitely want to encourage. But until they're at that point of feeling like they can't do this anymore, we want to reduce harm, whatever that looks like. And we've talked about harm reduction being such a big thing that has so many different techniques and different tools that are different for each kind of behavior and each kind of thing. Harm reduction is something that we can even think about in settings outside of drug use and outside of safe sex use too, of just ways that we reduce harm. Technically, vaccines are a harm reduction because we're trying to prevent harm. We're really focusing on not stigmatizing people, which is how we describe people. When we say someone is an addict or an alcoholic, that really defines them as their disease, as their substance use. And that's not really fair. We say people are diabetic. I don't like that word either. You're more than just your diabetes. Similarly, diabetes has not quite the same stigma as drug use. That might be something people are still comfortable using, but I think it's better in general to use person first language. So saying person battling addiction, person living with addiction, someone struggling with substance use disorder, someone that is not using, or someone who's in recovery. So those are all more positive ways to describe people that you're trying to say that they maybe have used or use, but not defining them as this thing that they're experiencing in their life. So we talked about what is a drug and how that's a very blurred thing. We tend to think of it something that alters how our brain works or gives us like a different feeling, gives us different perceptions of things. And that is what we think about as a drug. But in terms of what we think of as something that deserves punishment or that is really bad, that only bad people use, there's no really fair way to define that. And then remembering that the feelings of like frustration at people who use drugs, of anger, of feeling like that's just such a negative thing. These are things that have been put in our minds by a lot of the war on drugs and even colonialism itself. For some indigenous populations, drugs were done in a reasonable way, in a way that wasn't debilitating, but really impacted their spirituality. And that was almost seen as a danger. And seeing some of the lack of spirit in our government and in how colonialism has affected so many people in a very negative way, you can imagine that having some of this spirituality of drugs gave to indigenous populations were actually like a danger and a threat to colonialism. So it's been an ongoing thing for a lot of people in power that have felt like that is something that we have to decrease and we have to make it a thing that everyone kind of hates and is against. And that really evolved at that time to being like really marginalized communities, people that had nowhere to turn in the early 1900s, turning to drugs, there being a specific punishment and really horrible things done to Black and brown communities using the war on drugs and the stigma and the perceptions of drugs to excuse mistreating people. It really comes from the desire for a lot of people in power to want to be mistreating and suppressing certain groups. Just remembering that that's the history of it, that we want to try to fight some of that stigma that's put in all of us, similar to stigmas of racism and of homophobia and things that society has done to us, of putting some of those biases in our brain. We want to try to fight that because that can actually be directly harmful to some people to have those perceptions. So remembering that there's many reasons that people do use substances. And once again, we're not like condoning drug use, we're not promoting it, but we understand that people are using this for real reasons. And oftentimes the self-medicating for pain, anxiety, and depression, treating their withdrawal symptoms, all of that to me is saying that a lot of these people don't have good experiences with healthcare, don't have trust in healthcare. And a lot of that is very valid. A lot of people in the medical system who use drugs are very mistreated, very stigmatized. So really understanding that most of these people have nowhere to turn to. Some use of drugs isn't necessarily just terrible and bad. There are some spiritual purposes. Also remembering the fine line between what's a drug and what's a medication. Some people are on benzodiazepines amphetamines or opioids for chronic pain that's prescribed by their doctor because they need it. We want to try to fight the urge to say that those are bad medications because some people really do need those medications. There's also just so much more push for doing more research on ketamine and magic mushrooms and seeing that actually having smaller doses can actually positively impact your body. So really understanding that there's very blurred lines. There's a whole spectrum of people using or not using, having a severe addiction where it's really affecting their relationships, their work, which is a problematic place to be, where we really want to be figuring out ways to get a little bit back on the spectrum to lower risk use. Going from addiction to lower risk use is really the goal of harm reduction, where you're still accepting that maybe there's use if you have an addiction to certain things. But some people, if their addiction reached this breaking point, they're like, I want to just stop completely. And they could go straight to non-use. And that's also great. Just remembering that it's less so where the end point is, that it's more so that we're starting to push people towards the left on the spectrum, towards getting to a better place and to healthier use that's not really hurting themselves or other people. The main ways that we want to reduce harm from opioid use, the biggest one is obviously Narcan as community members. For people that are using opioids, making sure, especially if they're injecting, to use clean syringes and new syringes completely. You can't just sanitize. But some people, that's still better than nothing. That's still a harm reduction technically. And then testing your drugs for xylazine. Fentanyl is in every single opioid on the street right now. So that's why it's really important to have Narcan, because it puts you at such high risk for overdose. But testing for xylazine, this is a horse tranquilizer that can cause really bad wounds for people who use opioids. So we want to make sure they test for that if they're using opioids. And then not using alone. There's a hotline that we want to encourage people to use. Also trying to push them towards using methadone and buprenorphine, which are harm reduction medications. Even though they bind to some of the same receptors as opioids, they're not as potent. They do not cause a high in the same way. And these are really important, helpful medications for opioid use. Like how you think for diabetes or for other things, you take medication for that. Opioid use, drug use, substance use, when it gets to a point of addiction, that is a disease itself too, where people that it's really affected their whole physiology to an extent that their body needs that drug usually. Even though it seems a lot of people have these skepticisms of methadone because it's technically an opioid as well, it is really not the same type of opioid, and opioids are very variable, and methadone is something that is a medication that is for helping people with opioid use disorder. A reminder of how naloxone works. So it usually takes 2 to 8 minutes to actually function, and it lasts for 30 to 90 minutes. So these are like someone that's oversaturated with so many opioids. You give them the Narcan spray in their nose, and then within 2 to 8 minutes, it'll start displacing those opioids off of those receptors in your brain. And initially, we want to look for signs of someone with an opioid overdose. If you're worried, someone that's passed out, slow or not breathing, if they're unconscious, not responding, you do a sternal rub to try to wake them up. You don't have to be seeing every single one of these, but if they're really passed out, not waking up, there's no harm in giving them the Narcan. So you just plunge it into one nostril, then you wait 2 minutes until you give the other one in the other nostril. Sternal rub is the biggest thing. You want to shout, try to wake them up. You do want to call 911 and just say for medical, and don't really give details of the person's race, just the location where they're at, and just say they need medical help. When you do call these numbers, you can identify yourself as a community health liaison or something in order to just have that kind of command when you talk to law enforcement. You can just say, this person is down. I know the signs. I'm trained in Narcan. We just need someone on site with Narcan. And sometimes it's good to not mention drug use, but if they're going to send law enforcement, then you do want to make sure they have Narcan, because they don't always. But you can just say, I'm trained in community health and someone needs help right now, and only medical help. So you could say that. If someone's not really overdosing, but they're like going in and out, you should ideally still call them for help, or just leave your Narcan close to them. If someone is still conscious but nodding, you don't want to give them Narcan. They're probably just high at that time. You just want to leave Narcan kind of close to them if you can, and maybe keep an eye on them if you're in that area for a while. Just as a review for how you do the Narcan, you open it, make sure you don't press it or mess up the Narcan while you're opening it, and then you just put it into the nostril, just the tip into the nostril. It doesn't have to go super deep. And then you give them the second dose in the other nostril if they don't wake up after 2 minutes. And then for cocaine use, there's unfortunately nothing to reverse. You have to go to the hospital. There's no easy way to reverse cocaine intoxication or cocaine overdose, but you do want to encourage people to use clean sniffing kits that we're giving out in our street outreach. People who use cocaine, ironically, really should test for fentanyl and xylazine because fentanyl is contaminating the cocaine supply. Even though fentanyl is technically a opioid, it's in all opioids now at this point. Everyone who uses opioids knows that on the street, but it's in cocaine. It's not in every single cocaine, but it is becoming more and more common. So people really should test their supply. And then xylazine, like we talked about, same thing, horse tranquilizer that can also be found in cocaine. They should also have Narcan. Every person who uses cocaine should always have Narcan and also not use alone because of the same risks of opioid contamination and opioid overdose. For alcohol use harm reduction, we want to encourage eating before drinking, keeping track of how much people are drinking. If they know that they struggle with boundaries with alcohol use, avoid mixing like other alcohol, don't mix it with drugs. So these are things that we want to encourage to people who are starting to struggle with alcohol use. Generally, just reminding ourselves of looking for those signs where we're maybe drinking too much. So heavy drinking is if you're drinking more than 8 drinks per week. That's more than a drink a day, basically. That's like a concerning time. So if you're drinking like a drink a day and you're like, oh, just wine with dinner, and then on the weekend you drink more, that's really heavy drinking already. So that's something to be aware about. For men, it's 15 drinks or more per week. And binge drinking is drinking 4 or more drinks at a time for women, and then 5 or more drinks for men. So being aware of those signs, alcohol use as well as substance use, a big rule of thumb when wanting to reduce harm, especially when it's really affecting relationships or your work or your day-to-day. And most of these do affect your mood in some way. Obviously, the ideal is not using this as ways to treat your mood because it can long-term hurt your overall mood or even the next day, but really trying to focus on how we can reduce that harm and get to a bit of a better place in relationship with that substance. Often people will say for tobacco use, it's even harder to quit because it doesn't affect your relationships or work. Maybe it can because like having a partner that doesn't like the scent and all of that, but it doesn't give you a high or change your behavior enough. So some people feel like it's even harder to quit because it's just become a habit. You just go out for a smoke and you can come back and work just fine after. But it's still something that's deadlier than all the other substances, ironically. It's the number one cause of preventable diseases in America and preventable deaths in America. So it's really something that causes such severe heart disease, all sorts of cancers, obviously lung cancer being a huge one, and COPD being another huge one that it causes and can often lead to death as well. So remembering that this is a pretty dangerous substance actually, because it's a sneaky one. And harm reduction for this is not smoking indoors, being cognizant of people around you, not smoking around children, and really trying to cut back. Quitting is the most ideal, but even just cutting back can be really helpful and a good step towards quitting. There's some good medications out there that many people don't know about or haven't tried enough of, but Chantix as well as bupropion are the main medication pills that can really help people's cravings and help get people to that place of not smoking. There's also patches, lozenges, and gum that actually have some nicotine in them, much lower than actual cigarettes, and can help really cut back on those cravings. Harm reduction for cannabis use, for people that are using cannabis, encouraging not to use with other drugs or substances, not to roll the joints with tobacco that can actually be a lot worse for your lung health, and not holding the smoke in your lungs because that can hurt your lungs, not using a cigarette filter, just like the mechanics of how the cigarette filter is, it can actually be worse than when you're like burning the weed, how you inhale it. So it could be worse for your lungs. You don't want to use too much paper when you're rolling because that's giving you a lot more burnt paper that's giving you like carcinogens. Then using reliable dispensaries or dealers and trying to smoke only CBD. Edibles is often better to avoid lung and heart harm. Cannabis use, we don't really talk about it as a harm reduction tool for the other substance uses. It can be something to consider for people who are having a lot of pain and trying to treat it with like opioids, for example. People that use cocaine, what they're getting from cocaine isn't really similar to cannabis use. Opioid use too, some of that feeling is also very different from cannabis use. It's much more of like a really euphoric, relaxed state that cannabis use can cause, but oftentimes that's not really the direction that people go. The real direction for getting off of opiates or cutting down is to be using other opioids because the receptors in the brain have already been so affected by the opioids that they are using, that cannabis doesn't really bind to the same thing to give them that same sort of pain relief. Most people who use opioids will really need something to replace that, because otherwise it's very excruciatingly painful to have those receptors empty. There's not really much research on cannabis use as like a harm reduction tool for alcohol, but that may be something in the future that could be actually helpful, because it's definitely not as harmful in terms of the health effects as really severe alcohol use. As a reminder, substance use is really connected to the individual who's using the substance, as well as their family and loved ones and friends, as well as their overall community, and how we want to approach addiction if we have a loved one and it's affecting them. Not having secrets or shame or stigmatizing them. It's reasonable to be frustrated and to be angry about someone's life and how it's affecting your life directly too, but that stigma and that shame can actually just make things worse. And what those people really need is professional help. And so trying to have those conversations to get them to a better place and getting them to a place where they can find professional help. These are all roles that people have that are reasonable and coping mechanisms, and they feel like the only option, but there are negative effects on all of them. So really being someone that just tries to do everything for that person who's using substances and just clean up their messes and all of that, that's not helping that person learn that their addiction is hurting people. They may just over rely on you, and that's not healthy. As much as it feels like it's helping, it's maybe okay to do that to a certain extent of building that rapport, that like support and trust with that person, to really show that you care about what their lives are and what their life is, but you don't want to be this person that they completely just lean on. You don't want to be someone that just distracts them. That's also not sustainable and not really addressing their illness. You don't want to be completely checked out or just ignore it. That also isn't going to help you or them. Making sure you care for yourself is a huge thing. Talking to your loved one and really focusing on not being judgmental. And if you're already at a place that relationship is really rocky, it may have to come from someone else, and acknowledging who can be really a champion for this in that family or in that unit to encourage someone to seek help, but really centering, not judging, and then also showing as much compassion and using your resources. There are groups and resources and support groups out there for people who are family members or loved ones of someone who's struggling with drug use. Move on to sexually transmitted diseases. Harm reduction is using condoms consistently, especially if it's a partner that you aren't as familiar with. For birth control, that's a whole separate thing. If it's someone that you're unsure of their history, or you yourself also aren't monogamous with them, you want to be using condoms consistently. And then really having conversations with your partners. This is a good thing for literally everything. Communication is something that we feel like we're just taught, like that we're just like born with and we can do it fine. Sometimes looking at some tools to help actually have these conversations is helpful, because conversations are really hard and are a big reason for fights and for miscommunication and all of that. So really being clear with someone, being able to read their body language and really feel truly like you can trust someone is really important. Being able to be straightforward of, have you been tested recently? Can we wear a condom because we're not exclusive? And getting tested yourself as well. And then using PrEP. So PrEP is pre-exposure prophylaxis. This is HIV prevention. Right now, there's not really similar pills for other sexually transmitted diseases that prevent that disease. So if you are a male who has sex with male, or a woman who has anal sex, this is something that you should really consider taking. And if you have multiple sexual partners, it's just being at higher risk of HIV. Also, any syringe use, you want to be able to use this pill that you take every day. And there's very minimal side effects for most people that take it. So starting to do that every day prior to actually having any sort of risky sexual encounters or injection drug use, that can really prevent your HIV risk. HIV is very much out there still. This is an important thing that we want to do if we're doing anything that puts us at risk for HIV. PEP is post-exposure prophylaxis. So you take this if you haven't been taking PrEP, or you missed a few doses, you had a sexual encounter that was riskier, or injected drugs, then you take the post-exposure prophylaxis. So you can take that within 3 days of having that risky moment to prevent HIV risk for that. You can call the PEP hotline immediately if that is of concern, and you can take it within those 72 hours. You're taking it every day for a month. but within those 3 days is when you have to start it. PrEP to prevent that you take every day if you engage regularly, or even if you're anticipating that you can get also at Settlement Health or Mount Sinai through your primary care doctor. DoxyPEP, same thing. It's post-exposure, so it's after you've been exposed. But if you had a sexual encounter that you're unsure of their status for gonorrhea or chlamydia or syphilis, DoxyPEP is an antibiotic that you take after that exposure, and it can prevent anything from developing. So these are both ways. This is HIV PrEP that you take before, and HIV PEP, which is post-exposure. And DoxyPEP is for specifically gonorrhea, chlamydia, and syphilis. Those three sexually transmitted infections, you take this after you're concerned about being exposed. This is really a newer one that's really helpful for a lot of people, because previously, after people have had that exposure, it's really like, I guess we just test. That's mostly what you could do in the past, was just test like a week or two later and then give treatment once you're positive. But taking this right away before you even test positive is much better to just avoid and prevent getting gonorrhea, chlamydia, or syphilis. For intimate partner violence, this is something that everyone should be aware about, it being just so common, oftentimes really hidden, and oftentimes the signs can be really hard to recognize. There are 1 in 4 women and 1 in 10 men experience some sort of sexual violence or physical violence, or even stalking by an intimate partner. It's really common. We don't talk about it enough, especially for teenagers. 26% of women experience some sort of intimate partner violence before they became an adult, and 15% of men. That's a huge amount. Harm reduction for if you've experienced intimate partner violence, but also for other people as well. And as a community of being able to talk about what signs are actually toxic for people and what's of concern. So people that are very controlling or showing some sort of like control or ownership over their partner, being really jealous or not wanting someone to have their freedom, those are all really concerning signs. To reduce the harm of it, having a safety plan, knowing some networks that you can lean on, and then utilizing some sort of resources, hotlines, shelters, support groups, and really supporting your friends, trying to talk more openly about your relationships. If something's not feeling right with your partner or with a loved one, talking about it with someone you trust, even your doctor or other healthcare professional, whether that instance or the interaction you had with your loved one was of concern or not. And then knowing that there's so many resources out there. A lot of these resources also will be very confidential if they call you back or talk to you. You can always change names in your phone. You can save them as a contact, but change their name into a fake name. So thinking about ways to approach that. I hope that we learned over the last 6 sessions is that community care is so important. There's so much you care about your bodies and about health. That's really a special thing. You serve as a role model for people. It's so important that we are looking at other people also in our community with the same sort of love and grace that our communities really deserve, because ultimately even people that have been rude on the streets or have done harmful things, a lot of the people in this community have really done that as a result of really messed up things that have been done to them, whether that was from their traumas in their childhood or anything is traumas related to the prison system and policing and our government really putting a lot of stigma and making us not look out for each other. These are some of the resources, both for family, the Friends of Recovery and Oasis and SAMHSA. They have good resources for families and community, encouraging people if they use opioids or cocaine to call this hotline that sends medical help if they do overdose and not any police. Smart Recovery being another thing instead of Alcohol Anonymous that people can use for alcohol use. On Point for people who use opioid injection drugs, cocaine. The REACH program, that's a really great primary care clinic for people who have used in the past or are currently using drugs or alcohol. For HIV exposure, these are some of the resources there. Remembering the PEP hotline that you could just call up and get prescriptions right away for PEP if you are concerned about HIV exposure.
Thank you for talking about the overlap of racism and homophobia and all of that. I think that is so important to this conversation. I really appreciate you highlighting the kind of bigotry that plays into how we think about drug use and how we can combat that with harm reduction. I wanted to just show everybody real quick what a naloxone kit looks like. I just want to show you everything that's inside it. You have 2 doses of naloxone. So you have one that you can do and then a backup one. You have gloves. You have a face shield for if you're doing rescue breathing. And then you also have a really great, just sort of step-by-step reminder of the steps for administering naloxone. The aim is for everybody to carry naloxone so that you have it and you know how to use it if you come across someone who is overdosing. If you need basically anything that we talked about as far as harm reduction supplies, condoms, lube, naloxone, sentinel test strip, access to resources, reach out to us. If you need COVID test kit, we are pretty hooked up with things right now.